Hey, Matt Reed, ADHD coach, theinplace.net, coming to you live from my car in this no frills extravaganza about how ADHD affects girls and women differently from how it affects men and boys. I'm doing this off the top of my dome. I might not be the most well organized. I might not remember to say everything. And if I did, that'd be like 10 minutes anyway. So I'm going to try to give you some high points today. All right, why I'm an expert. Not in addition to being an ADHD coach and a trained ADHD coach, I am also a guy who was diagnosed at 10, and that means I've known what I've been dealing with, ADHD, through pretty much every stage of my life, with the exception of old age, and I'll do that eventually. And I now have 2 kids with ADHD, so I've done that too. What I have never been is a woman or a girl with ADHD. But I have enough knowledge of ADHD and of my clients and of the recent research to, I think, be an expert on that as well. Though not from personal experience. So here's what we know. We know that girls and women with ADHD tend to be less hyperactive. They tend to be more inattentive. Although I would argue our definition of hyperactive is a little too black and white. Verbal hyperactivity or fidgeting, twisting your hair, that kind of stuff. I mean, it's essentially like small market hyperactivity, but mostly girls are inattentive. Generally speaking, boys externalize and girls internalize. So, and they generally compensate better. So, a lot of times what you see is a boy takes a test and he fails it and he's like, fuck this, fuck that, stupid test, stupid teacher. Am I allowed to say that? Is that going to get edited? I don't know. Whereas a girl will say, oh, I'm stupid, I did something wrong, and then will go home and do 4 hours of homework for what should have been 1 hour of homework and not say anything. And that often leads to, self-harm, eating disorders, anxiety disorders. It's not a great outcome. Because here's one of the main problems, is that we ask, what can we not do? Or clinicians ask, what can a kid not do because of their ADD? Well, not do? Okay. But what can a kid do at an enormous price? That's a different question. The 4 hours of homework to get 1 hour of homework done, that's an enormous price. That's a kid who is being affected. They're having to work way too hard to maintain the grades. But a lot of times, the teachers and maybe even the parents don't even realize this is happening because the girls mask so well. And, to add insult to injury, there are studies that show that the ADHD rating charts, where you have to have like 7 out of 9 symptoms to be diagnosed for ADHD, they only really work very well for boys, for hyperactive people, and for people with severe ADHD and not great compensation strategies. So I might check 7 or 8 boxes, right? But for some reason, a woman who checks 5 or 6 boxes, her functioning may be diminished in the same way that mine is for 7 or 8. So we really need to redefine different thresholds for the 2 genders and understand that it's not always cut and dry. Sometimes people have enough compensations to not check enough boxes, but underlying the compensation, there very much is the disorder. Here's an example why. When I was a kid in the 80s, they told me, A, this was a childhood disease. Not true. Studies show that about 15% of people, ADHD remits in adolescence, which means it goes away. So the vast majority of, and I question the metrics on that. I have to get deeper into those studies. But for the most part, you got it for life. And the other thing they told me was that it was 5-to-1 boys to girls. Now, the latest DSM-5 revised shows it as 1-to-2 women to men in kids, or I should say girls to boys, and then 1-to-1.6 women to men in adults. So, in the last DSM, it was 3-to-1. So I've always maintained that that number is going to be equal, that it's something that exists in our society, in our genetic makeup, that isn't gender specific. However, it manifests very differently, and that's why a lot of women fall through the cracks. I have tons of women who get diagnosed when they get to college, when they get to grad school, when they have to write a thesis, when their first kid is born, or maybe it's their third kid. They manage to compensate long enough with a brutally difficult life, but at a certain point, we all hit the wall. And their wall tends to be later, but it doesn't mean that it's any more or less important. It just means they should have been diagnosed earlier because they were working really damn hard to get this far. One last point, because this is getting long. I will point out that recent studies have shown that ADHD is very static in the life of a man. For me, I've been on Concerta. That's my medication of choice. I supplement it with other stuff, but Concerta is the main wheelhouse one. And that I've been on the same dose since it came out when I was 22. So 22 years, I haven't needed more, I haven't needed less. I don't anticipate that changing. And I don't have much variability within my days. Whereas women, not so static, because hormones really affect dopamine production. I believe, and I'll check on this and make sure, but I believe estrogen helps produce dopamine, so that there are parts of a woman's cycle where they're just not going to be as effective. They're not going to be as focused. The question is, do we need to treat, that week of a month more aggressively medication-wise? Can a doctor prescribe a little something extra? I don't think we're there yet, but my question is, why not? Why aren't we looking at this different presentation and treating it with different rules? Probably because the FDA, actually the DEA, doesn't like to do that with controlled substances because they don't like treating us. Last thing. I'm getting back to writing my book, and the first two parts of it, I want to redefine ADHD and redefine attention. And I think one of the biggest problems with science, and I'm a huge fan of science, and all of what I'm telling you now is based on studies that have been done. And studies are so important. But here's the thing. Nothing's true until it's true. And we don't want to believe something is true, or we shouldn't. We should be skeptical of something until it's proven through peer-reviewed studies and duplicated research, right? But at the same time, it's kind of like Moneyball versus the eyeball test if you're a baseball fan. I see things in my practice, the hundreds of people that I've worked with, that are clinically obvious, but they're not medical fact yet. So until we go out and do that study and prove it, it's not a real thing, according to the DSM, right? Which is very invested in having things be black and white, yes or no, on or off, sub-threshold, threshold, one thing or another. And psychiatry and brain science really just, there's not a lot of that. There are some diseases that are either on or off, but like ADHD is a lot like autism in that it's on a spectrum, and I I think they've identified a constellation of like 200 or 300 genes that affect ADHD, plus some environmental factors. Like, we're not all going to look the same. And if you try to assume that we do all look the same, people are going to get missed. One of the best people to read, the person who really got me into this when I saw her speak at Brown maybe 12 years ago now, is Dr. Patricia Quinn. Really good books on ADHD for girls and women. Big thumbs up on her. And there are a couple other great people working on that, but their names are escaping me right now. So start with Patricia Quinn. She's been doing this for a long time, and she was one of those people who was fighting the establishment to say, I see this in my clinical practice. It's real. Yes, let's do the studies, but let's not wait for people to suffer in the 5 years it takes to do this study and then repeat it and then prove that it's fact. Anyway, that's ADHD and girls and women. I think I got everything in there. Feel free to post comments if you think there's something I missed. Please be productive. And for the record, about 65% of my clients over the years have been women, and the behavioral approach to helping women is the same. That's not different. So that's something that's nice. All right, Matt Reed, The In Place, ADHD since 1978 is the YouTube channel. I'll catch you next time.